Good morning and welcome to our webinar series, Beyond Open Enrollment, Keeping Benefits in Focus Year-Round. I think we can all agree that no one benefits from unused benefits. And also, we agree that we live in a super consumer age. For example, every retailer I have ever ordered online sends me notifications. I get texts from Amazon to refill my vitamins and beauty products. I get notifications from Walgreens and CVS to refill my prescriptions. I actually forgot to turn off Uber notifications after my last trip, and I get reminded to order food from Uber at least 3 times a week. We are conditioned for these constant reminders, and if we don't get them, we start to forget. Now let's look at our healthcare benefits. Healthcare benefits represent 17 to 30% of our total income. We call that total rewards. Why then, despite the importance of our health benefits, we seem to forget them after open enrollment until we absolutely need to see the doctor? By the way, because many of you know, I use an advanced independent primary care provider, Dr. Wendy Molaska. I actually get important notifications from her office, both on text and on my email, but that topic is for another webinar. I am hoping with today's webinar, we will help employers think like marketers and communicate constantly and consistently. So hello, everyone. I'm Elena Cambizzi, Senior Vice President of Business Development and Strategic Marketing here at the Alliance, and I will be moderating today's session. I want to wish everybody a Happy New Year. I have not seen many of you since last year. This is the first event of 2024 for the Alliance. Today, we'll talk about the first post-enrollment mind shift, why it happens and how to tackle it. Second, how to keep the conversation going strong and stay on everyone's radar. And third, how to connect healthy habits with benefits and shine a light on those hidden perks within our plans. Couple of housekeeping slides. You're all muted during this presentation, but as you know, we still want to hear from you. If you have questions or need technical support during today's presentation, please type them into the chat box on your screen. We also have several handouts that are available for today's session, including a copy of the slides and a sample benefits calendar you can use to help you know when to promote different benefits throughout the year. For our broker consultants joining us and needing CE credit, please download and sign the form that is also found in the handout section. For those requiring SHRM or HRCI credit, please email us at events@the-alliance.org. The recorded video of today's event will be made available for on-demand viewing from our events page on our website, and we will email a link to all the attendees next week when it's available. So let's before we get busy, I cannot forget our incredible sponsors. Thank you to Delta Dental and National Cooperative RX. They sponsor today's program, and they are incredible sponsors throughout the year for us. We truly appreciate your support. It helps us continue to bring these valuable programs to our employers and our partners. So Lauren, join us. I would like to welcome Lauren Winans from Next Level Benefits to share her expertise on our topic. Lauren is an HR professional, consultant, and entrepreneur. Prior to her 20-year HR career, Lauren worked for Highmark Blue Cross Blue Shield in Pennsylvania, acquiring extensive knowledge of the health insurance industry. Her insights have been featured in several media outlets such as BBC News, USA Today, US News and World Report, and NBC News. And now, as a mother of a child with unique medical needs, she regularly leverages her professional experience in her personal life. Welcome, Lauren, and I will turn it over to you.
Thank you, Melina. Really appreciate it. Great to be here with all of you. I'm excited to share some insights with you as it relates to keeping benefits in focus year-round. I am hoping that you can see my screen. You just got my intro, so go
Yes,
ahead.
Lauren, we can see you. It's all good. Yes, thank you.
Perfect, perfect. So you just got my intro there, and Melina did a wonderful job. Thank you so much for introducing me to the group. I have been in corporate HR roles for a couple decades, about 20 years before I started doing HR consulting work. And so I'm really excited to be here with you today and to talk more about employee benefits. And one of the first things we're going to get into, as Melina had mentioned, is we're going to talk a little bit about the post-enrollment mindset. Post-enrollment is, it's tough to keep people's attention. And so we really need to understand what that mindset shift looks like. And so when we think about open enrollment, it most commonly takes place in May to June for a July 1 plan year, or October to December for a Jan 1 plan year. And then if you think about those time periods, right after open enrollment, employees are making a very big decision about what type of health plan they're going to have for the year. And then they're immediately shifting gears into either those summertime vibes or some holiday fun. So it's difficult to reel them back in, which is ultimately what our challenge is as HR professionals, as benefits administrators, is to kind of reel people back in and keep them focused on benefits that they have available to them, so that they're not in a situation where they don't know what they have when they need to use it. So capturing that attention is naturally going to be challenging. And, as much as we love benefits, as much as I love benefits, not everybody loves it. It's not the hottest topic to talk about. And so you have to get really creative with bringing people back, helping them to kind of shift their mindset once again from the fun stuff to things that they need to know to keep themselves and their families healthy. And so, just kind of listing off some of the, the obvious here, there's a lot of barriers to engagement. So not just that mindset shift that we're dealing with post-open enrollment, but also, benefits is complex for a lot of people. And so that complex language can get in the way of engaging employees and helping them to understand the benefits that they have available to them. They might find certain aspects of your benefits program not as relevant as others. If you think about, where we are in our life stages, sometimes a 401k benefit is much more relevant to us, and maybe healthcare is much more relevant to us at certain points in our lives. And so sometimes lack of relevance can get in the way of engagement as well. Communication overload. Melina was giving some great examples as we kicked off here. We are constantly bombarded with information. Reminders, messages, emails, things that can be distracting and can take us away from focuses that we need to be having either at work or with some personal situations. And so communication overload is always going to be at play, and we have to be very careful and strategic about when and how and what we communicate to employees because of that. Frequency fatigue is something that, I think that we don't necessarily know what the right frequency, how often should we be communicating with our employees. We're going to talk a little bit about that, later on in this segment, but frequency fatigue is something that can be a barrier to engagement. If you think about how often you receive messaging, from Uber or from anyone really, sometimes you get desensitized to it. It's coming, it's coming a lot. And so you don't read every single message. So finding the right frequency is very important. Like I said, something we're going to talk about today. Limited understanding kind of goes back to that whole, the complexity of benefits. Not everyone understands every term, every piece of and component of the healthcare industry and how it works. They may not understand their 401k plan entirely because some of the jargon that's used is not that easy to understand. They might not necessarily even understand some of the ancillary benefits that are available to them because they haven't taken the time to really sit down and understand the different components of their benefits package. And then lastly, another barrier to engagement is the communication channels. Sometimes people prefer a certain channel over another channel. And it's a lot of trial and error because your specific organization, might prefer one type of method of communication over another. And I think that is something that, we have to give ourselves grace, that a lot of these barriers to engagement are often actions and trial and error opportunities for us, who are responsible for communicating benefits and keeping it top of mind. So I did list a few things here to address some of these challenges, but we're going to be naturally kind of talking through this through today's conversation. But some of the ways to address some of these challenges are really, considering simplifying language, using clear and concise formats, ensuring that communications are relevant to employees' needs, thinking about, okay, if I've got someone who's close to retirement, they're going to care about the benefits in a different way than we have someone who may have just entered the workforce and is new, to our organization. So we have to just be, thoughtful around how we're communicating, what we're communicating, and making sure we can keep it relevant for everyone. Exploring different communication channels. We're going to talk a lot about that today. We can talk through, all of the technical, technology methods that are out there, but we don't want to discount the importance of in-person meetings. It's another way to kind of increase and improve engagement and understanding of benefits information. And then lastly here, making information accessible, relevant, digestible. It's gonna help employees to be more confident, that they understand the terminology, and they understand their programs a little bit better than they did before. That's going to help them to stay engaged, keep engaged, and hopefully enhance that engagement as they learn more and more about their benefits packages. So we're going to be addressing all of these challenges in more depth in some of these future slides. But ultimately, this is what we're going to be talking about today. We want to come up with ways that we can get around these barriers that are pretty natural and common across every workplace, and develop ways that we can address those challenges that are more specific and customized to our specific organizations. So really the key takeaway here is, understanding and accepting that employees are not going to inherently want to engage with their benefits, but we're going to come up with ways that make the information more accessible, relevant, and digestible. So now we're going to move on to sustained engagement. So now that we kind of understand the post-enrollment mindset, how do we then kind of develop an engagement strategy and kind of start to build that foundation of connecting our messages to action? What does that look like? So we're going to spend some time here kind of talking through that. And I think one of the first things to talk about is the components of an engagement strategy. An engagement strategy can be as complex or as simple as you want it to be. That strategy is really meant to be a roadmap for you and any internal stakeholders that are going to be helping you with communication. So I think it's really important to think through, first off, you don't want your strategy to be too complex for you to be able to execute. So, give yourself, baby step into it if you need to. If you feel like you're in a place where you can dive right in and have a robust strategy, absolutely take advantage of that. But you definitely don't want to bite off more than you can chew too fast. So when I talk about an engagement strategy, there's various components here that kind of make up a strategy. Number one is strategic goals and areas of focus. So we're going to actually look at an example here on the next slide, where we kind of talk through kind of what some of those areas of focus could look like. You also want to have a good understanding of your current practices and how they're being perceived by employees. If you don't have that knowledge, it's going to make building a strategy difficult because you won't know which areas of focus are going to be most impactful and relevant to your organization. We're going to talk a little bit about how you can assess that, but some ways you can do that is by going through a benchmarking study related to the programs that you're offering and just kind of see how you stack up against your competitors. But it's also too asking your employees. It could be part of an employee survey that you're deploying where you dedicate 3 to 5 questions to employee benefits, so you can learn a little bit more about what's important to your employees, what areas they would like to engage in further, what knowledge they feel that they're lacking, and that they could, leverage you to really kind of help them get in, more in touch with and more educated in certain aspects of their benefits package. So, really, I think, current practices as well as the knowledge of best practices and how to integrate them into what you're doing is pretty important. And the only way you're going to be able to obtain that is through external sources. And so that's really important to kind of have as you're building your strategy. You're also going to need, a robust and relevant communications calendar. We do have a handout for you today that's available in the handout section of GoToWebinar right now, where you can, use it as a foundation for kind of customizing and building out a calendar for your organization. But really, it's about, developing content that's impactful to your organization and being very conscious with a regular cadence on how you're communicating that information, and ensuring that you're communicating year round and not just at open enrollment. And then lastly, a strategy needs support from internal stakeholders, and that is going to take the shape of your leadership as well as any peers that you have that can kind of help champion the engagement strategy and really kind of help to create a culture that is one of transparency, one of effective communication, and one of sharing, all of the different ways that your employees are being rewarded. That's, most naturally through compensation, but also through benefits, and sharing all of the wonderful programs and ways that employees can keep themselves healthy and can invest in their well-being as well as their family's well-being. So to expand upon that, here is just a sample strategic framework here. This is by no means what your strategy needs to look like. I just wanted to kind of bring it to life just a little bit so you can kind of see some areas of focus that would be helpful to build into your strategy, what some goals could potentially look like within those areas of focus, and how it's important to identify who your partners are and being able to leverage them. You should not feel like there is one person in an organization that's responsible for engagement for benefits. It is a team collaboration between internal stakeholders, leadership, as well as the carriers and the vendors that you are using to administer your benefits programs. And you can leverage them for communication, you can leverage them for some of their tactics and information that's relevant, and you should be tapping into your internal stakeholders to help you not just be the only face in the organization that's responsible for that engagement, but really kind of casting a wider net and encouraging your internal partners to care about it as much as you do and bring that forward in many ways. So some areas of focus to think about as examples are, a communication plan, personalized benefits packages, education and training, recognition programs, wellness initiatives, how to layer in feedback mechanisms into what you're doing to obtain employee feedback, accessibility and digital tools, and like I said before, leadership support. So, a strategy, a framework around engagement, these are areas that, are great to kind of push yourself and task yourself with a certain set of goals that can help you kind of determine, is your strategy working? Is it not working? How do we measure success? And how do we year over year kind of improve what our strategy looks like? So again, this is a sample. By no means does everyone's strategy need to look like this, but you might be able to take some pieces and parts of this to help start a strategy that can be customized to your organization and start to think more broadly about what type of partners you need along in this journey. So just to cover some best practices, so we talked about kind of developing that engagement strategy and how important that is as goal setting for ourselves, so that we kind of know what that roadmap looks like, and then when it comes to actually kind of executing on that strategy, kind of outline some best practices here. So you can think about the different ways that you should be thinking about building that strategy. If you can base it on some best practices, like we mentioned, that best practices is a component of really understanding how to build a great strategy. These best practices are, something that, we work with our clients a lot on, is really helping them to kind of think through, okay, what are the organizations out there that are doing this well? And what are they doing and how are they being effective? There's no reason to reinvent the wheel here. A lot of these best practices are common sense, but they're also things that are proven to work through other employers' programs. So I'm just going to touch on a few of them here. They're here for your reference as you consider building out a strategy that you can then roll out to your employees. When I think about best practices, I think about just asking employees what's important to them. We talked about that already, and how important that is. And you can find different ways to do that. That can be through surveys, as I mentioned. It could also be through a smaller focus group. Maybe there's a handful of employees that would be more than willing to kind of share their opinions and their what they find valuable in the benefits package, and maybe some areas that are challenges for them. Maybe it's just a small focus group of gathering some information. It might even be tapping into certain people within the organization that are managing larger groups of people who may have had to answer some questions before for their folks, and they might have some insight into, hey, I spent some of my staff meeting addressing some questions as it relates to the 401k. I really think that that's an area that we can leverage in terms of training and education for the entire population. So you can kind of gather, anecdotal feedback as well as solid feedback from a lot of people in different ways. You don't have to necessarily launch a large-scale survey, but that is a great way to obtain a lot of information. You can do it in smaller ways as well. The communications calendar that we talked about, you have a great starting point in the handout that we're providing you today. You can also, excite employees, without overwhelming them in your choice of words and the way you communicate. We're going to talk a little bit about that next. And then we're also going to talk about the different channels you can be using, the different types of technology you can be using, and how to, really kind of, be on top of making sure that your benefit package is competitive and that you are remaining, in that group of, competitive employers within your area, within your geography, within, your size organization. There's a lot of benchmarking tools available, and there's a lot of opportunities to kind of leverage to really understand, are we offering the right things based upon the feedback we're hearing, and the ways that we're communicating to people, and the types of communication that is resonating with them, and the types of programs that are resonating. Is there other things we should be offering? Are there things we're investing time and money into that are not resonating with employees? Should we shift those dollars over to something else that's going to be much more impactful? And then, prioritizing employee health and well-being is also, number one best practice in a lot of ways, and I think that that is something we should all be thinking about when we are developing benefits packages and then effectively communicating them, is ensuring that we're thinking about all of the diverse health needs that employees may be experiencing, not only throughout their lifetime, but just generally speaking, thinking about their spouses and their dependents, thinking about, different types of, diseases and or diagnoses that they may embark on throughout their lifetime. And, how can we support them through different stages of life and help them to develop a well-being strategy for themselves that is impactful and valuable. Really kind of communicating to employees that you care about them, and that you're intentional about their well-being and helping them to achieve some level of well-being that they're comfortable with, I think is going to go a long way. Sometimes employees step back from engaging with benefits or even engaging with well-being because they feel as if this must be a cost savings exercise that the company is trying to do. But if you really kind of establish your expectations and the reasons for why you're focused on well-being, I think that you can really help employees prioritize well-being in a meaningful way and help them to understand that you do care about them very much, and that you know, the byproduct of that may be some savings here and there, but ultimately, you know, a great well-being strategy and keeping employees engaged in that is not a cost savings you know, strategy by any means. And then also too, some additional best practices here as we wrap up this slide is, you know, a consistent benefits experience across different markets and locations is vitally important. You may have some of your populations might be dispersed a bit. They might not be easy to get in front of, and they might be the ones that are most at risk for not understanding the package that you currently have available. And then also, you know, we talked about internal stakeholders as serving as champions. There's absolutely, you know, a lot of case studies out there that kind of point to this being a best practice of, you know, if you can develop, you know, a team of cross-functional support throughout your organization to kind of jump in and actively promote well-being activities and different sorts of benefits throughout the year, you know, you can really get ahead and kind of build a culture around well-being as well as around benefits engagement. We're going to talk a little bit about that in some future slides, but keep that in the back of your mind as something to consider if you haven't already implemented something like that. So connecting health and engagement, I wanted to dive deeper into this because I do think it's really important, kind of piggybacking on what we were just talking about as it relates to well-being. There are lots of facets of well-being. We all know that, right? So there's physical well-being, which is naturally what you think of when you think of well-being, but there's also emotional well-being, there's financial well-being, there's workplace safety, there's, you know, spiritual well-being, there's inclusivity, you know, belonging to an organization. There's lots of different ways that we can kind of fill the cup of well-being. And so, you know, connecting health and engagement, you know, it can be a struggle, but there are a variety of reasons that we should be focused on developing strategies and rolling those out to our employees because there's a lot of benefit to connecting the dots here. Physical well-being, you know, healthy employees are more likely to be productive and engaged in their work. I mean, we know this ourselves, right? You know, when we're not feeling so great, you know, we're not maybe as productive as we would want to be. There might even be some lower engagement on those days that we're maybe a little under the weather physically, or maybe we're sore from a really great workout we had and we're really tired. That's a great way of maybe losing some productivity. But, you know, I think physical well-being is something that a lot of us take for granted until we're in a place where we're not feeling so great. And so, you know, kind of devising ways to encourage employees to really think about their physical well-being. And maybe that's through, you know, regular, you know, consistent routine checkups. It's through preventative care. It's through a variety of different things we can be doing for ourselves throughout the workday. You know, meditation, taking a walk around the block, just kind of putting a pause on what we're focused on, just to take a breather, walk away, step away from the desk, eating lunch away from your computer or away from your workspace. You know, these are all things that I think that can really kind of help not only physically, but also emotionally, which is our next bullet here. You know, a positive emotional state can enhance job satisfaction and commitment to your work. If you understand what your role is and you understand what the expectations are within your organization, and you understand the different benefits that are available to you, you know, should you need some support, you can really, you know, take control of your emotional state and be much more effective at managing your emotions, which is naturally going to enhance a lot of things in your life, including job satisfaction. Employee engagement and wellness. You know, we'll probably talk about this, you know, 3 or 4 more times as I'm talking to you all today. But, you know, highly engaged teams that have a focus on well-being, they do demonstrate greater profitability for an organization. And so emphasizing that connection isn't necessarily something that you need to be focused on at an employee level. But sometimes when you need to get some buy-in from leadership on certain well-being initiatives or certain communication initiatives. This is something that is solidly proven through various case studies out there, that highly engaged teams who, who are working within an organization that is focused on well-being, they really do perform at a higher level. They're more productive, and it also results in greater profitability for an organization. Connecting health and engagement also has an impact on workplace safety. Factors like communication and event reporting are influenced by engagement levels. So, if someone is on the job and they are hurt, maybe they trip over something and they twist their knee and they're struggling for the rest of the day, they need to go get it checked out, but they don't report it to anybody because they don't think anyone's actually going to care. They don't think their manager's going to care. They don't think that they really need to go to the doctor, even though it's really bothering them. They don't want to be a burden or a bother to the organization. There's a variety of reasons why people may not report workplace incidents, but ultimately, when you really demonstrate that an organization is connected to health, to well-being, to helping employees engage with how to be the best version of themselves, you'd be surprised. There's a lot of studies out there that actually show that the impact to workplace safety is one of the first levers. As engagement starts to instill itself in an organization, you see that there is more of a willingness to report incidents, to get the necessary medical treatment that an employee may need, and also be more apt to understanding the safety measures that an employer puts out, in terms of rules and regulations and policies. They're more willing to kind of, ensure that additional accidents don't happen, because everyone is more collectively on the same page of it's my duty to ensure that my coworkers are not hurt by anything that I do or not do. And so it develops a camaraderie, and it also influences employees to do the right thing. And then also too, work engagement, we also have to remember that everyone's, a human being trying to make it through the day, right? We all have a variety of different stressors in our lives that pull us in different directions at any given time. We have different coping mechanisms that we resort to. We might have some bad habits that kind of come out of that. And so, for all of us, it's a challenge sometimes to bring our best selves to work every single day. But really kind of establishing a engagement strategy that takes into consideration that not everyone's going to be performing 100% every single day, and there are a lot of people that are faced with personal challenges, family support, supervisor support, reward systems, personal habits like exercise and diet. These are all things that are going to influence our lives on a daily basis. And so engagement is more than just how we feel from a well-being perspective. We also need to think about engagement when we're building our own engagement strategies as it relates to benefits. Also think about how this can connect to your culture as a whole. How can you, through communication, through education, through even leadership development, help your organization to develop better engagement in all aspects of an employee coming into work every day. So there's lots of ways that we could talk forever on this topic. This is one of those ones that I can get on a soapbox and never get off, but connecting health and engagement is vitally important. And these are some of the reasons why. We are going to talk a little bit more about how to effectively take action in those ways in our next section here. But before I kind of close out, talking about building an engagement strategy and how to achieve that sustained engagement, I just want to review our key takeaways here. Sustained engagement requires proactive planning, as you can see from some of the things we talked about here. Building a strategy is a proactive step. It's not something that you're waiting around to do. You are going to take the initiative to develop something that makes sense for your organization. And building a strategy based on specified goals and best practices, and then using a thoughtful communications calendar to kind of roll that out to employees is really the best way to kind of, get started and get moving. You may have a strategy already in place. I think, if you have one in place, this is a great opportunity to kind of evaluate, is our strategy working? Should we make tweaks and changes? A strategy is not something that you put down on a piece of paper and it never changes. It is something that evolves and is a working document that will change and ebb and flow depending upon what the needs of your organization and your employees are. You definitely want to be revisiting that strategy each year, and each year, gaining more and more support from leadership and peers to help you execute, to help be champions. And that can look like something as simple as a leader in their quarterly staff meeting, bringing up, hey, we're going to spend 5 minutes talking about, a few benefits that we have available through our organization that are really important that you should know about. Or, maybe it's a peer of yours, maybe, a colleague is, willing to champion a well-being activity in the month of May and help you execute and maybe do a fun run or some sort of, on-site gathering. There's so many different ways that we can take, what support looks like, but in order for well-being to become a part of your organization, you need that support at the leadership level and amongst your peers in order to kind of move things forward, because it will be an uphill battle without that. So now we're going to move on to the final segment here, which is around effective communication. So we talked about, okay, the mindset that we're up against, right, post-enrollment. And then we talked about, okay, what's the best way to kind of achieve that sustained engagement? And so we know now that we've got to be proactively developing a strategy that fits with our organization. Now we're going to talk about how do we translate that into effective communication to our employees. What does that look like? How do we master what, when, and how? So I've got a few lists here of the what. So what is some information that matters? What should we be spending our time on? What should we be communicating? And when should we be doing it? So the what here, I've come up with a few things that I feel are important to communicate. And this is something that you can kind of use as a guidepost as you're developing a strategy and or a communication calendar. Think about the things that you would want to know. If you were an employee that knew nothing about the employee benefits program, what are some things that would be interesting to you? And so I thought about this through that lens. And so I came up with 5 areas that I think are something that an employee would want to know. They would want to know about important processes that they need to do and what those deadlines are and when they need to do them. They'd want to know about cost saving opportunities. They would want to know about where they can find educational material about certain things about their benefits so that they can read that on their own time. They would want to know specific deadlines as it relates to earning credit for wellness activities or PTO or whatnot. They would also want to know where's the free stuff? What free stuff do I have at my disposal? So kind of listed a lot of examples here. Examples like, the process of how to get a prescription filled. You'd be surprised how many people don't know how to effectively get their prescription filled. They might feel like they can only go to a pharmacy when there's a mail order opportunity. And so, just that's an important process that you can put out there in terms of communication. It could be something that you make a one-pager and it's available in the break room, or it could be something that you send out via email, at the beginning of every year so that everyone, who might have prescription needs, whether they be new or current, they understand what the process looks like. Cost savings opportunities. Proper site of care is something that most people, the average person, does not fully understand it unless you're actively communicating it to them. They may feel that the ER is the one and only stop for all things that they need done, and they're not considering that there's other sites of care that would be more appropriate, like a primary care physician's office, like an urgent care facility, maybe even an on-site clinic that you have available. Not everyone understands how to navigate the healthcare industry and how to save money doing it. And so that's, another thing that you should be kind of adding to your calendar is like, how do I, what would be important for someone to know? And then also, as an employer who's administering the program, proper site of care is not only a cost saving opportunity for an employee, it's a cost saving opportunity for you as well. So, there is some rationale behind some of the things we want to communicate. We want to help people and provide value, but we also want them to take advantage of things that will ultimately affect the company's bottom line as well. Educational material, like the importance of retirement planning. There are a lot of people who may not be saving enough for retirement. They may not understand the different facets and components of the existing retirement plan and program that you have. They may not realize that they might have access to free financial planning through a 401k vendor. These are all things that are important to educate employees about, as well as, how to use cost estimate tools, who to call for specific questions about claims that they may be receiving bills for. These are all things that you want to make sure you're communicating regularly and often. As well as, deadlines. Like I was just saying before, if you've got to use it or lose it PTO plan, you've got to let people know when they should be taking their time off and at what date they're going to, lose that time. You'd want to be clear about spending accounts and when those deadlines are coming. If there is a rollover feature, what does that look like? And if there's any sort of credit that you are providing for wellness initiatives and activities, letting people know what the rules of the road are there, and sending lots of reminders is really helpful. Sometimes, I don't know if you've heard the adage of 7 ways, 7 different times. I'm probably saying it the wrong way, but sometimes, people need to hear the same thing multiple times before it sinks in, and they may need to see it in multiple places before it becomes something that's on their radar. So, don't hesitate to communicate those deadlines more than a handful of times, because it's important for people to see it before they'll register it. And then, free stuff, right? So preventative services, reminding people, hey, don't forget to get that annual physical. Don't forget to take your child for their well visit. Don't forget to get your mammogram, your colonoscopy. All of these different things are, free services for, in-network providers that you may visit as part of the Affordable Care Act. And it's important to kind of remind people that that's available to them. And there's often a lot of other free stuff that people just aren't thinking about when they're thinking about benefits. They may not think of it as a benefit, but you can help remind them that, flexible work, workplace perks, professional development, EAP, company paid life and disability, these are all things that in one way, shape, or form, they're getting for free or for a very low cost. And so, reminding them that these things are there and available, how they work, how people can tap into it, is very important. And when we talk about when, okay, so that's a lot of information. So when am I supposed to tell people this? Just like, I was sharing, there's a handout available to you. It's kind of a starting point as a monthly benefits communication calendar. Really just, think about how to align your message to the natural flow of a calendar year. You don't want to be overly communicating every single month, 3 or 4 communications a month, but maybe 1 or 2, maybe 2 communications go out each month that kind of talk about, something that's top of mind or relevant. So for example, in January, you'll definitely want to communicate if you're on a January 1st plan year, hey, it's a new plan year. Deductibles have reset if there's a deductible. If there's no deductible and co-payments are in play, reminding people of the co-payment amounts and how they apply to which visits, awareness of proper sites of care, scheduling your annual preventative exams. January is a great time for that sort of thing because it's the beginning of a year. It's providing people a heads up of things they should be thinking of. And then, April is probably a great time to be reminding people about financial well-being. They will have just probably filed their taxes, may or may not be getting a refund. Could be a good opportunity to remind them to enroll into the 401k plan if they're not already enrolled. They could be increasing their contribution level at this time of year, maybe even investing some of their refund into a Roth IRA or another sort of vehicle that might be available. And reminding people to schedule summer PTO. So, I'm not going to read through the rest of the examples, but, I think if you can identify your what and align it to a natural flow within a monthly cadence throughout the year, it will be a much more effective way of rolling out your message to your employees. And I also listed here some lesser known benefits that I think are just important to kind of think about whether or not these are things that you are currently offering. If you are offering them, do people really know that they're available? And if you're not offering them, is this something that you may want to consider adding to your program? This is a lot of these are kind of trendier benefits that have kind of been at play here over the last 3 to 5 years. So some of these might not look all that familiar to you, but these could be something that you could be adding to your benefits package, or if you already have them included, ensure that you're communicating that you do have something like this, because something like caretaking support or education assistance or mental health services, these are things that people, when they need them, they need them. And so if they already know proactively that this is something that you offer, they'll know who to go to when they need support. Using various channels to roll out all of this information is incredibly important. I've listed a variety of different methods here of ways to communicate to your employees. I always kind of encourage people, just explore different communication channels. You aren't going to know until you try it. I think a lot of people will say, oh, you know what? In-person or hard copy materials is the only thing that the only way we can communicate to our employees because they're just not technologically savvy. And that may very well be, but we also have to remember that everyone has a phone. Everyone has a phone that, most likely is a smartphone. And you can access information in ways from a mobile perspective that could be just as good as that in-person meeting or that hard copy material. But you've got to kind of research your options and figure out what you're capable of within your own internal organization, as well as your existing carriers and vendors. How can you leverage them to deploy information on your behalf? And another thing too that I always kind of rely on to kind of identify, okay, well, which one of these 10 or 12 different communication methods is going to work best for us. You can actually identify and develop personas that kind of give you insight into the best communication methods for your employees. What that looks like is kind of identifying, okay, we've got the majority of our employees are female and between the ages of 35 and 50. Maybe knowing that information helps to inform what type of communication method you think is going to work best for them. Maybe the majority of your employees are an hourly workforce that once a day ends up having a stand-up meeting with a team lead and clocks in and out in the break room. So maybe your communication methods are going to be stand-up meetings, having those team leads communicating information that you want people to know about, and the bulletin board that's right above the time clock. It's really just kind of identifying who your employees are and what's the best way to kind of get information to them for them. And then lastly, you can leverage technology in a variety of different ways to kind of simplify access to information. You can create dashboards that has all the information that an employee might need all in one space. You can kind of enable push notifications, single sign-on, virtual assistants. There's so many different technology tools out there But it really is kind of up to you in terms of, how far you want to leverage tools through other vendors or through, your own technology internally. Like how far do you want to invest and to kind of put things and make them available to employees? It's really your preference, and that's why I always encourage to kind of, this is a trial and error effort, and you really kind of have to try the different methods and see what sticks. And measuring effectiveness is incredibly important. All of these items here around measuring effectiveness, I mean, we're talking about looking at utilization reporting, we're talking about looking at open rates and clicks and views, conducting surveys, as we mentioned, and really kind of just, identifying what are the measurable metrics that are going to be helpful for me to determine, is my communication effective? And is my strategy, ultimately my strategy that I've come up with, is it effective? And, we all want to have an A+ at the end of the day, but sometimes we need to evolve the way that we're doing something. And that's okay. And the only way you're going to know that is if you do measure what, are you being as effective as you could be? So key takeaway on this section, you got to master the content, the timing, and the method of the communication. And sometimes that's going to be trial and error, right? And, measuring effectiveness of messaging, it's going to provide you the insights that you need to make changes year over year and evolve your strategy. And I did summarize for your notes today all of the key takeaways from the 3 sections that we talked about today in our conversation: post-enrollment mindset, how to achieve sustained engagement, and developing effective communication. They're all summarized here on slide 19 if you're interested in just looking at one spot for everything we learned today and went over. And that brings me to the end of my conversation. I've got my contact information here. If anyone is interested in reaching out, always happy to hear from people. And with that, I will zip it here and let Melina kind of take over. We might even have some questions that we want to kind of attack today.
Yeah, thanks, Lauren. This was fantastic. I'm glad I was muted because I sounded like a choir. Oh, hallelujah. Yes, yes. Thank you for including so many other benefits, because yes, a lot of our employers, it's not just a health benefit. And I love this idea of the belonging, because once an employee feels that they belong to the organization, this is their family, right? Half of the day, this is their family, then they can we can help get them much more engaged.
Sure.
We do have quite a few questions. Let's take a couple. We don't have a lot of time. And folks, if you need to ask questions, please post them in the chat. So let me start with how can employer benefits move employees towards better health? And how do I communicate wellness benefits that employees can use every day? I think we've touched upon all of them. You've done a great job at sort of summarizing. Maybe you can help us summarize here.
Sure. I think that, the best way to kind of move employees to better health is just reminding them of all the things that they have available to them through their benefits program. And then also, I've seen a lot of our clients as of late, they've really been focused on kind of identifying what the barriers are that people are experiencing, because sometimes it's not as obvious as you would think, and then really kind of tackling those barriers as well. But also communicating wellness benefits is something that is more of an art than it is a science. You really have to kind of think about who you're talking to, finding the right timing for that information. Like we were saying, January is a great time to remind people to get that annual preventive exam. And April may be a great time to remind people, hey, are you saving enough for retirement? So it's about finding relevance throughout the year and really kind of establishing the best way to get information to them, and thinking about the smaller aspects of your benefits program sometimes usually ends up being sometimes the most impactful thing that an employee can kind of learn from and take advantage of. So sometimes we have to take off our expert hat and put on a employee who might not realize all of the things that we know hat to really kind of develop an effective strategy.
And so a couple of different things in what you said, and actually I'm going to try to combine a few of the questions that I see in front of me. So first of all, first and foremost, as you said, we have diverse workforces, different stages of life, different ages, different nationalities, or gender, etc. So we have to deal with that complexity. We also have, and that's one of our questions, we also have current employees that have been with the company for quite some time, but new hires. And then kind of the ultimate, right, the Shangri-La for everybody, we have spouses. And often spouses, particularly women, right, take care of the health benefits of the family. So how do we segment and how do we try to communicate with all these different segments? I know it's too many questions at the same time, but we can start them from current employees versus new hires, and then employees versus spouses.
Yeah, I mean, if you think, when new hires are coming in, they're a blank slate. So you have such a great opportunity to kind of roll out every single program that you have available, but you also need to be careful that you don't overwhelm them too fast and too soon, because they're also learning a variety of other things through their onboarding process. Existing employees, I love that monthly approach of, okay, what is important this month that I should be sharing with people, and how is it relevant to what's going on in our lives? That whole, January, April conversation that I've thrown out there is a couple of examples. The wonderful handout that the Alliance has created as it relates to like a starting point as a monthly benefits communication calendar. Really kind of thinking about your existing employees, the ebbs and flows of your business. What's a busy time of year? If July is a really busy time of year for your organization, don't pick July to send out your best communication. Really kind of cater it to your organization, and I think that's going to be the best way to capture existing employees. Also, we talked about methods, communication methods. You've got to try things out and see what works. Sometimes something that you would not expect is the key to the castle. So you just have to kind of play around with it and see what works and measure the effectiveness of everything you try.
And I know we're running out of time and I do need to, but what about spouses? Can you just give us a 30-second response? And that's a big one.
It is a big one. So I always, like the idea of sending hard copy material to a home address. I know that it's snail mail. I know that, we're in a different age now of technology, but it is the most effective way to get information into the hands of a spouse. We were on my husband's benefits for a long period of time, and that's how I got information. We would get a postcard, we would get a handout. I'd be the one picking it up from the mail. I'd be the one looking into it, seeing if it was right for me and my family to register for that free benefit or take advantage of it. So, I'm maybe a little bit old school in that thinking, but I do think, hard copy going to home is a great way to ensure that spouses are involved. You can also invite them to some of the on-site meetings or benefits, open enrollment meetings that you host. Why not have them come on site, learn a little bit, maybe even get a chance to mingle and meet each other. It could be a social opportunity for people. I know I'm always looking for those since I'm taking care of 2 kids through the week. But it's always something to think about. How do we incorporate the families into this too? Because they're just a part of this well-being, as the employee is.
Lauren, you and I could be talking about these topics for hours, right? That soapbox you talked about before. However, I do have to wrap up. We have 2 minutes left in our session today. I want to thank you on behalf of the Alliance and on behalf of our employers. What an amazing presentation. We will have it. It is recorded. We will have it on our website. So please, so much impactful information. Please come back and look at it. So thank you for taking time today. Let me wrap up here. So if you're an Alliance member and you want to hear more about this topic, you need some help, please contact me. Scan the QR code on your screen as well. That's another way of connecting with us. I will put you in touch with the right Alliance person, your account manager most likely. Don't forget, we have some handouts, including that 12-month sample calendar. What else? So yes, so email us if you need to sign up for C credits. I want to invite you all to join us at our spring symposium. It will be in person. It's at Monona Terrace. It's coming up April 10th. I really want to see all of you there in person. We have an incredible event with panels, with providers, employers, brokers, consultants. So really would love to see you there. Thank you again for joining us. Thank you for the privilege of your time. And please remember, when you think of the Alliance, think self-funding smart. Have a good day, everybody.